Most of us like to snack while watching TV, but you might want to pay attention to the type of program you're watching when it comes to its effect on your waistline. I'm Rochelle Grossman with your latest health news. New research shows that people who watched a fast-paced action film consumed far more food and calories, about 65% more, than those watching a slower-paced interview show. Researchers say the action film featured a lot of camera cuts and sound variation. They say it appears the more distracting a show, the less attention people paid to eating, and therefore the more they ate. You can always try eating individual portions instead of straight out of the bag.
Vitality and strength, two valuable attributes for many men. But how many males are putting their health on the line with testosterone replacement therapy? An FDA panel recently voted to address its use. I'm Miranda Savioli with your latest health news. An FDA committee recently voted 20-1 to tighten use of TRT. The panel reviewed a previous study that suggested men on TRT had a 30% increased risk of heart problems. They also requested further research into the link. The panel recommended the FDA labels TRT more strictly for men with medically low testosterone only, such as testicular cancer patients. The FDA could also stop manufacturers from advertising the medication for age-related testosterone loss. Always discuss potential side effects with your doctor before taking a new medication.
Multiple studies have shown the many health benefits of fruit, and when it comes to heart health, the more fruit, the better. I'm Erin White with your latest health news. The connection between fruit and heart health is not new. The American Heart Association recommends eating 4.5 cups of fruits and vegetables a day for the average adult on a 2,000-calorie diet. Now, a new study from China found that the more fruit people ate, the more their cardiovascular disease risk dropped, and the more their blood pressure improved. Fruit also appeared to lower the risk of death. Compared to those who never ate fruit, regular fruit eaters had a 32% lower chance of dying. Eat fruit daily to help lower your risk of heart disease.
Amyotrophic lateral sclerosis, otherwise known as ALS and sometimes called Lou Gehrig's disease, is a nervous system disease that attacks nerve cells in the brain and spinal cord. These nerve cells transmit messages from the brain and spinal cord to the controllable muscles. No one knows what causes ALS, but it can run in families. At first, this causes mild muscle problems. The earliest symptoms may include twitching, cramping, or stiffness of muscles, muscle weakness affecting an arm or a leg, slurred speech, or difficulty chewing or swallowing. Eventually, strength is lost and it becomes difficult to move. When muscles in the chest fail, breathing becomes impossible. The disease usually strikes between age 40 and 60 years of age. More men than women get it. There is no cure, but medications to control excessive salivation and frequent coughing can help manage the symptoms. Patients with ALS should do breathing exercises and make sure immunizations are up to date. Physical therapy, occupational therapy, and rehabilitation may help to prevent joint immobility and slow muscle weakness and atrophy. Individuals with ALS may eventually consider forms of mechanical ventilation such as respirators.
With case estimates as high as 1.4 million by mid-January, the Ebola outbreak continues to spread in West Africa. In response, the FDA approved an Ebola treatment for emergency limited use. I'm Erin White with your latest health news. The FDA approved TKM Ebola, produced by Techmira, for emergency use in patients with Ebola virus disease. TKM Ebola is still being researched, but the FDA and Health Canada have worked together to approve the treatment for limited use on select patients. The latest report from the World Health Organization says that among recorded cases of the disease, the fatality rate is over 70%. Speak with the doctor about any concerns you may have about infectious disease.
Seniors often tell younger people not to get old, but aren't they called our golden years for a reason? A new review says how the elderly can keep feeling youthful. I'm Miranda Savioli with your latest health news. The contributing orthopedic surgeons wrote that being fit can help with aging, noting that idle lifestyles and medical issues contribute more to age-related decline rather than aging itself. The authors also stressed that diverse exercises benefit the whole body, and a weekly routine should include resistance, endurance, flexibility, and balance training. They also recommend increasing carbohydrate and protein intake if exercising intensely. Talk to your doctor about establishing a healthy diet and exercise routine for your lifestyle.
By translating health information into a consistent, easy-to-understand language, the Daily Rex News Network enables you to take control of your health. Sign up for the Daily Rex newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at dailyrex.com. Your health starts here.
A new study shows older women who eat the most potassium live longer and are less likely to have a stroke. I'm Rochelle Grossman with your latest health news. Researchers assessed more than 90,000 postmenopausal women and tracked their diet. They found that ladies consuming the most spinach, potatoes, carrots, mushrooms, and fruits high in potassium were 12% less likely to have a stroke and 10% less likely to die. Not everyone, however, should eat more potassium. People with chronic kidney disease may be harmed by eating too much. Consult a dietitian about the right diet for you.
Cerebral palsy is a group of disorders that affect a person's ability to move and to maintain balance and posture. Cerebral palsy is caused by an abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Cerebral palsy can be caused by genetic abnormalities. Other possible causes include congenital brain malformations, maternal infections or fevers, or fetal injury. The symptoms of cerebral palsy vary from person to person. Those with cerebral palsy may exhibit a wide variety of symptoms, including lack of muscle coordination, stiff or tight muscles, and exaggerated reflexes, or spasticity. Weakness in one or more arm or leg is also another symptom. People with cerebral palsy may have difficulty walking and may have trouble with tasks such as writing or using scissors. Some have other medical conditions, including seizure disorders or mental impairment. The signs of cerebral palsy usually appear in the early months of life, although specific diagnosis may be delayed until age 2 years or later. Risk factors include low birth weight and premature birth, infections during pregnancy and complicated labor or delivery. There is no cure for cerebral palsy, but treatment can improve the lives of those who have it. Medications such as botulinum toxin can be given to help manage spastic movement disorders. Physical, occupational, speech therapy, and recreation therapy can all help patients with cerebral palsy.
More than 125 million people across the globe have psoriasis. The FDA recently approved a medicine that may help treat them. I'm Miranda Savioli with your latest health news. Plaque psoriasis is the most common form of psoriasis and is marked by bumpy red patches of skin covered in white scales. Last March, Otezla was approved to treat psoriatic arthritis, a form of arthritis that can affect plaque psoriasis patients. Now, the FDA approved the medication to treat plaque psoriasis patients with moderate to severe cases. Managing psoriasis is important because it often presents with other conditions like heart disease. Ask your doctor about emerging treatments for your condition.
Tuberculosis, or TB, is a disease that is caused by bacteria called Mycobacterium tuberculosis. Tuberculosis can cause symptoms such as a bad cough that lasts 3 weeks or longer, weight loss, loss of appetite, coughing up blood or mucus, weakness or fatigue, fever, or night sweats. The bacteria usually attacks the lungs, but can also damage other parts of the body. TB spreads through the air when a person with TB of the lungs or throat coughs, sneezes, or talks. A weak immune system increases the risk for TB. Being a healthcare worker can also be a risk factor for TB as well. If not treated properly, TB can be deadly. TB disease can usually be cured by taking several medications for 6 to 9 months. The medications used to treat TB include the following: isoniazid, rifampin, ethambutol, and pyrazinamide. Patients diagnosed with TB should avoid alcohol and should stay home until a doctor says it's safe to return to work or school.